placental development, we have got one MCQ here which is asking us about the false statements regarding the development of placenta and its membranes. As we notice, the very first choice, it is asking us about tertiary villus. But then tertiary villus is actually developing in the 3rd week of development. In fact, it is day number 17 to 21. So obviously it cannot be day number 10. First we have got primary villus, then secondary villus, tertiary villus comes later. So immediately we find our answer. The false statement is choice number A. Then what about choice number B? Is it okay? Fetal circulation, here we are talking about fetal placental circulation, and that fetal placental circulation, some books are telling it is established at day number 17, some of them are telling 21, so this range is okay, no problem. Choice number B is fine. Then what about this placenta developing from decidua basalis? It is the maternal component. Actually, placenta will have two components. One is maternal and one is the fetal. The maternal component is the uterine endometrium, decidua basalis, whereas the fetal component is coming from the villi, the chorionic villi, and called as chorion frondosum. So no problem here. This is the fetal component of the placenta. So choice number D is fine, C is fine, B is okay. Only choice number A is a wrong statement, the false statement, and that is our answer. But then we have to find out the details which we have seen here, and we can come back to this question once again, once the entire information is with us. Here we are looking at our transverse section of the developing embryo, and we understand that there is a dorsal cavity, amniotic cavity, and ventral is the yolk sac cavity. This yolk sac cavity is primary yolk sac, then becomes secondary yolk sac, and then tertiary yolk sac. We have a diagram to discuss the three of them. We know that in the beginning there are two cell layers in the embryonic disc. The dorsal is the epiblast at the floor of the amniotic cavity, and ventral is the hypoblast, which is at the roof of the yolk sac cavity. But later, it is the epiblast which is going to form the three germ layer. As the epiblast is going to form the three germ layers, that is the ectoderm, mesoderm, and the endoderm, what will happen to the hypoblast? The hypoblast will be removed and does not contribute to the embryo. It will be contributing to extra embryonic tissues. Maybe it can form extra embryonic mesoderm, extra embryonic endoderm, but it is not contributing to the embryo. Is it contributing to placenta? Yeah, maybe it is contributing to placenta, but that is extra embryonic structure. In fact, placenta is contributed by the trophoblast cells. Tropho means nutrition. The trophoblast cells, as you see, they are in the periphery. They will be proliferating, and when they are proliferating, it is seen that they will lose the cell boundaries and they become the syncytiotrophoblast. So there will be a syncytiotrophoblast and there is a cytotrophoblast. So there are two types of trophoblast, and they'll be contributing to the placenta for nutritional purpose. These trophoblasts, they are also contributing to the amniogenic cell layer, as seen here. You can mention the trophoblasts are forming this roof and lateral wall of the amniotic cavity, contributing to the amniogenic layer here. This amniogenic layer, which lines the roof and lateral wall of the amniotic cavity, is contributed by the trophoblast cells. Then what about the lining of the primary yolk sac, what is called as the Husser's membrane? This Husser's membrane is being contributed by the hypoblast cells. As you will notice, here is the Husser's membrane, and it is lining the primary yolk sac is contributed by these hypoblast cells. Then what about this mesoderm, which is outside the embryo, which is called as extra embryonic mesoderm? And if we focus here on the extra embryonic mesoderm outside the embryo, it is a controversial question. Long back, there used to be a description that the extra embryonic mesoderm is coming from the trophoblast, but then it was negated. Later it was mentioned the extra embryonic mesoderm is coming from epiblast, then negated. Some authors said it is coming from the hypoblast. Then what is the latest answer? If you look at the latest literature, they'll say extra embryonic mesoderm is coming from the cells which are lining primary yolk sac. And which cells are lining the primary yolk sac? It is just mentioned that the primary yolk sac lined by the cells will form the extra embryonic mesoderm? That should be your first answer. The question is, extra embryonic mesoderm is derived from. Your answer is cells lining the primary yolk sac. And if that option is not there, then the older answer you can go for hypoblast. And if that is not in the answer, then epiblast. And which is the oldest answer? The trophoblast. So oldest answer is trophoblast, but the latest answer you should remember, cell lining the primary yolk sac. Now this is extra embryonic mesoderm. What about the embryonic mesoderm? The embryonic mesoderm will be here between the two layers. We know it is the epiblast which is going to form ectoderm, mesoderm and endoderm. That is the embryonic mesoderm. So after some time we'll find at the floor of amniotic cavity you will have the ectoderm. Below that will be mesoderm, the embryonic mesoderm. And then at the roof of the yolk sac cavity will be the endoderm. The three germ layers all coming from the epiblast cells. And now we are going to make this diagram ourselves. So here we draw the transverse section of the embryo and we are talking about the two cell layers. Dorsal is the epiblast cells, and when we are looking at the ventral cells, then they are the hypoblast cells. Then we have mentioned that there are two cavities as well. Dorsal amniotic cavity and ventral is the yolk sac cavity. The cells which are lining the roof and lateral wall of the yolk sac cavity called as the amniogenic cell layer. Where is it coming from? This amniogenic cell layer is coming from the trophoblast cells, which are still at the outer aspect. So can we draw them? Yes, let us do that. There are cells which are at the periphery and we are calling them as the trophoblast cells. These trophoblast cells, as they divide, they lose their cell membrane and they are called as syncytio trophoblast. So there are two of them, syncytio trophoblast and the cytotrophoblast. And they were contributing to the amniogenic cell layer which is lining the roof and lateral wall of the amniotic cavity. Then what about the lining of the yolk sac cavity, which we are calling as Hughes membrane? If we are talking about this Hughes membrane, then it is derived from the hypoblast cells. It is lining the primary yolk sac here. So hypoblast is forming the Hughes membrane and the trophoblast is forming the amniogenic layer. This much we have got. What about the extra embryonic mesoderm, which is outside the embryo here? If you are talking about this extra embryonic mesoderm, then it is derived from the cells which are lining the primary yolk sac. So the cells which line the primary yolk sac will contribute to the extra embryonic mesoderm. And what if I do not have that option? Then go for the older answers in literature. Extra embryonic mesoderm is derived from the hypoblast cell, and if hypoblast not in the option, then extra embryonic mesoderm is derived from the epiblast cell. And if that is not in the option, which is the oldest answer, the extra embryonic mesoderm is derived from the trophoblast. The oldest answer I found in literature, but the latest answer you must keep as the cells lining the primary yolk sac. Now this is extra embryonic mesoderm. What about the embryonic mesoderm? The embryonic mesoderm is coming from the epiblast. It is the epiblast which will form embryonic ectoderm, mesoderm and endoderm. As you mentioned, the epiblast will form the three germ layer, embryonic ectoderm, mesoderm, endoderm by the process of gastrulation. Then we have to talk about a third cavity as well. There is a amniotic cavity, there is a yolk sac cavity, and then comes the third cavity, which is intra-embryonic coelomic cavity. But then what we are going to talk about now is extra-embryonic coelomic cavity. And that extra-embryonic coelomic cavity develops within this extra-embryonic mesoderm. See, in the embryonic mesoderm develops the embryonic coelomic cavity, and in the extra embryonic mesoderm develops the extra embryonic coelomic cavity, and dividing the mesoderm into two components. That will be evident in the next diagram, and let us move on to that. So this is the next diagram in succession where you can find there is development of extra embryonic coelomic cavity. Let us magnify this diagram and discuss the details. And as you notice, this is the space we were talking about, which is called as extra embryonic coelomic cavity. And how this extra embryonic coelomic cavity develops? Actually, in the beginning, there will be some small lacunae developing in the extra embryonic mesoderm, which will coalesce cells fuse with each other and then form this cavity. And because of this extra embryonic coelomic cavity, the extra embryonic mesoderm is divided into two parts. There is a outer, which is somatopleuric extraembryonic mesoderm, and there is one inner, which is splanchnopluric extraembryonic mesoderm. So extraembryonic mesoderm has been divided into two parts now. The one which lines the yolk sac here, at the moment it is called secondary yolk sac, is called as the visceral extraembryonic mesoderm or splanchnic extraembryonic mesoderm. You can mark it here. The visceral or splanchnic layer of extraembryonic mesoderm, the mesoderm which is lining the secondary yolk sac. Otherwise, whatever else is beyond that is called as the somatic layer. Say, if you look at this one, it is somatic layer. Let us mark it also. As you notice, this is the somatopleuric layer of extraembryonic mesoderm, and between the two, we have got this coelomic cavity, what we are calling as the extraembryonic coelomic cavity. So this cavity divides the extraembryonic mesoderm into two components. The splanchnic layer or visceral layer is just covering the yolk sac. Otherwise, if you follow the somatopleuric layer, you'll find it is almost everywhere except the lining of yolk sac. Let us trace it now. And as you do so, this somatopleuric layer of extraembryonic mesoderm, as you are tracing, it is going to meet with the visceral layer, but to reach there, it is going around and passing along the connecting stalk. The connecting stalk, which is the other name of primary umbilical cord. So as you are following the extra embryonic mesoderm, which is the parietal layer or peripheral layer, or you can say somatic layer, it is reaching the connecting stalk or primary umbilical cord, and then it will line the amniotic cavity and reach the splanchnic layer on this side as well as other side. So as is evident, the extraembryonic mesoderm has been divided into two components, the visceral component lining the yolk sac and the somatic layer which is outside. Then if you remember, we have mentioned the amniotic cavity was lined by amniogenic cell layer. Let us show it once again. This is the amniogenic layer lining the amniotic cavity given by the trophoblast cells. This amniogenic layer and the somatopleuric extraembryonic mesoderm is the one which is called as the amnion. So amnion is a layer which is covering the amniotic cavity, and this amnion is being contributed by amniogenic cell layer plus the extraembryonic mesoderm, the somatopleuric layer of extraembryonic mesoderm. Then what about the chorion? Chorion also has somatopleuric layer of extraembryonic mesoderm, but it is on the outside. As you see here, this is the chorion. So what is chorion being contributed by? If you look at the chorion, it also has the somatopleuric layer of extraembryonic mesoderm, but along with that it has additionally the trophoblast. So when it comes to chorion, it is the outer membrane, and it also has the somatopleuric layer of extraembryonic mesoderm, but along with that it has got the trophoblast. The chorion is outside, amnion is inside, and they are continuous with each other on the primary umbilical cord. Actually, the umbilical cord will be lined by the amnion, and then amnion becomes continuous with the chorion at this point. And we are going to draw this diagram ourselves now. And as we draw this diagram, which is now showing dorsal amniotic cavity, ventral yolk sac cavity, but this time we are going to call it as secondary yolk sac cavity. And by this time we will find there are three germ layers also formed from the epiblast cell: the ectoderm, the mesoderm, and the endoderm. These are embryonic layers and they would have come from the epiblast cell. Then we know that a third cavity develops, which is embryonic coelomic cavity. But at the moment we are not focusing upon that. We have to focus upon extra embryonic coelomic cavity, and for that purpose we have to mention the extra embryonic mesoderm being divided into two components by the cavity. So what is the name of that extra embryonic mesoderm which was lining the secondary yolk sac here? The visceral or splanchnic extra embryonic mesoderm. Let us show it here. The mesoderm, which is lining the yolk sac cavity, is called as the splanchnic or visceral extra-embryonic mesoderm. Then what about the mesoderm which is lining the amniotic cavity? That is the somatic layer. Let us show it here. The one which is lining the amniotic cavity is also the extra-embryonic mesoderm, but is called as somatopleuric layer of extra-embryonic mesoderm. And in fact, this layer is going on to what is called as the connecting stalk or the primary umbilical cord, and then it continues around the cavity which we are calling as extra-embryonic coelomic cavity. So as you complete this layer of somatopleuric extra-embryonic mesoderm, we can mention between the somatopleuric layer of extra-embryonic mesoderm and the splanchnic visceral layer of extra-embryonic mesoderm, this cavity is what we are calling as extra-embryonic because it is outside the embryo coelomic cavity. And when you have this extra-embryonic coelomic cavity, that is the time you were calling the primary yolk sac as secondary yolk sac, lined by splanchnic layer of extra-embryonic mesoderm. Then what about the placental membranes, the amnion and chorion? We know this amniotic cavity was lined by amniogenic cell layer. We can show it here. These amniogenic cell layer, they were coming from the trophoblast, and you have to show the trophoblast still at the periphery. So here is the amniogenic cell layer, which is forming the amniotic fluid in the amniotic cavity, came from the cells which are still at the periphery, and we are calling them as the trophoblast cells. And these trophoblast cells, we know, as they are forming the amniogenic cell layer, they themselves are two types. As we know, there is a cytotrophoblast and there is a syncytiotrophoblast. Now, here is the amnion membrane, which is basically lining the amniotic cavity and is contributed by the amniogenic cell layer plus extra-embryonic mesoderm, the somatopleuric layer. Then, what about the chorion? Chorion also has extra-embryonic somatopleuric layer, but along with that, it has trophoblast. So, we can mention this outer layer is the chorion, and even the chorion is having somatopleuric extra-embryonic mesoderm, but along with that it has the trophoblast cells. And later this chorion will form the chorion frondosome and the fetal component of the placenta. Between the chorion and the amnion, we have this cavity, the cavity which we are calling as extra-embryonic coelomic cavity. And we have understood the amnion is lining the amniotic cavity and is also lining this connecting stalk to become continuous with the chorion. This connecting stalk is also called as primary umbilical cord. You can show it here. This is the connecting stalk, or you can call it as primary umbilical cord, and it is to be lined by the amnion. Amnion, which lines the amniotic cavity, lines the primary umbilical cord, is now continuous with the chorion, which is on the outside. And between the amnion and chorion, we already have mentioned, is the extra-embryonic coelomic cavity. And as I mentioned, this is a controversial question asking us about extra-embryonic mesoderm. If you look at the oldest edition of Gray's Anatomy, then the answer will be trophoblast. Then it got changed into epiblast, then hypoblast. And what is the latest answer? The latest answer is cells which are lining the primary yolk sac. So the best possible answer, latest answer is choice number A. Otherwise, even the epiblast, the hypoblast, even the trophoblast can be seen in the older editions of Gray's Anatomy. But the latest answer should be cells lining the primary yolk sac contribute to extra-embryonic mesoderm. And once the extra-embryonic mesoderm develops, extra-embryonic coelomic cavity, then the primary yolk sac is re-termed as the secondary yolk sac. There is a tertiary yolk sac also. Let us look at the diagrams now. But keep your answer as choice number A here. In these diagrams, we can see there is a primary yolk sac becoming secondary yolk sac, and then tertiary yolk sac. As we have seen in the beginning, there's a dorsal amniotic cavity, ventral is yolk sac cavity, and that yolk sac cavity is the primary yolk sac. Actually, it is coming from the blastocyst cavity, and it was lined by some cells the user's membrane formed by the hypoblast cells. Then we have seen the primary yolk sac is returned as secondary yolk sac. Let us magnify this diagram a bit. When do you start calling it as secondary? We call it as secondary yolk sac when we have got a extra embryonic coelomic cavity. So this is the extra embryonic coelomic cavity, and this time the yolk sac will be covered by a splanchnic layer of extra embryonic mesoderm. That is the time we call it as secondary yolk sac. You see it is giving a diverticulum which is called as the allantois. Allantois has no significance in the humans, though in the lower organisms it is acting as some excretory organ, maybe storage of urine and all that, but not in the humans. In the humans, it will simply degenerate. Now, we will see as the baby is developing, this amniotic cavity becomes larger. It becomes so large that it is going to cover almost the entire embryo. May it be in the cephalocaudal folding or lateral folding, it becomes quite huge. And since the amniotic cavity becomes larger, the yolk sac cavity becomes smaller. It will be evident in the next diagram. That is the time when you can call it as tertiary yolk sac cavity. So let us zoom out. And as we see, here now, the amniotic cavity is becoming so large that it is compromising the yolk sac cavity. This yolk sac cavity gets incorporated into the embryo and forming the gut tube, the foregut, the midgut and the hindgut. And it is continuous with the midgut with the help of a White-Lane duct also. At this time, now the yolk sac is called as tertiary yolk sac. You can mention this is the tertiary yolk sac which has become very small, and you can see this is the midgut diverticulum, the vitalointestinal duct. There's a hindgut diverticulum, the allantois, and both of them are becoming the content of what is called as the umbilical cord. Later what we find is this yolk sac, White-Lane duct and the allantois, all of them will be degenerated, and what is left is just the gut tube, the foregut, midgut and the hindgut in the adult individual. And now we want to focus upon the placenta formation. What you see here is the fetal placenta. We have known the outer membrane is the chorion membrane, which has this green color somatopleuric extraembryonic mesoderm plus the trophoblast, cyto plus syncytial trophoblast. This is chorion, and in the chorion there will be villus, primary villus, secondary villus, tertiary villus. There will be a chorion frondosum, the fetal placenta. So let us talk about fetal placenta as well as the maternal placenta in the next diagrams. If we talk about the maternal side of the placenta, it is contributed by decidua basalis. Decidua is the functional endometrium, and if you see here, this is the implanted conceptus, which is at the moment blastocyst, and it has implanted into the endometrium. You can see the endometrium having three components, where the decidua basalis is the functional endometrium, which will be contributing to the maternal placenta. Otherwise, you see the decidua, which is covering the implanted conceptus or the blastocyst like a capsule, that is called decidua capsularis, and there is one more decidua which is in the periphery, hence called as the parietal, the decidua parietalis. So this is the decidua parietalis which is in the periphery, not in proximity with the embryo. You can show it on the entire lining of the uterine cavity here, whereas the one which is covering the conceptus as a capsule is the capsularis. You can show it here. The one which is helping us in formation of the maternal placenta is actually here, the decidua basalis. So three type of decidua we have seen. This is the maternal placenta. Let us focus upon the fetal placenta as well in the next diagrams. And here, as we magnify the developing conceptus here, we will see it was covered by the chorion, and the chorion membrane, the placental membrane, is giving us finger-like projections, which are in the beginning primary, then they become secondary, and then tertiary. And these finger-like projections, they will be modified towards the decidua basalis side, but will be lost from the opposite pole, that is towards the decidua capsularis, and that is where it is called as chorion levi. The one which is fetal placenta is called as chorion frondosum. Let us magnify this diagram. As you will notice, we already mentioned it is the decidua basalis, which is the maternal placenta component, and now we are looking at the fetal placental component, where you are having the chorionic villi, the finger-like projections from the chorion membrane. That is the chorion frondosum, the fetal placenta component. You also notice that there's a chorion levy where we lose all those villi, and it is in close approximation with the decidua capsularis, like a capsule covering the embryo. In this diagram, we can see this is the conceptus here, and which is surrounded by the enlarged amniotic cavity covered by the amnion. Outside that is the chorionic cavity, which is covered by the chorion. This is the chorion frondosome contributing to fetal placenta. Then we have the maternal placenta, which is decidua basalis. Let us first show the three parts of decidua here, starting with decidua basalis. And as you show that, this decidua basalis, which contributes to the maternal placenta, is continuous with decidua capsularis here. Like a capsule, it covers the baby. And then you can mention about this peripheral endometrium on this side, as well as better seen on the other side, the decidua parietalis. So if that is the decidua parietalis, you can mark it here. This is the decidua parietalis, whereas on the inside, this is decidua capsularis. What is this cavity between the two? Periphery decidua parietalis covering the conceptus decidua capsularis. Between the two, we have got the uterine cavity, which is becoming narrower as the baby is growing. And we are not concerned with these decidua. What is important for us is the decidua basalis, which will be the maternal placenta. You can mark it there. So we have named the three parts of the decidua here. What about the placental membranes associated with the baby? The baby is suspended in the amniotic cavity here, now almost covering the baby, and the lining of that is the amnion. You can show here, this amnion is covering the amniotic cavity all around. It will also cover the connecting stalk or the primary primitive umbilical cord. So as you see, inside the amnion will be the amniotic fluid in the amniotic cavity. This is the amniotic cavity. Suspended in the amniotic cavity is the fetus. And this is the amnion membrane, almost all around the conceptus and also covering the primitive umbilical cord. There it is continuous with the chorion. Let us now show the chorion membrane on the exterior, continuous with amnion. And as you show it, this is the chorion membrane, and you can see it lies outside the amnion. What is this cavity which is between the outer chorion and the inner amnion? This time you can call it as the chorionic cavity. This is the chorionic cavity. And then, as is evident, the chorion towards the decidua basalis is developing some finger-like processes, primary, secondary, tertiary villi, contributing to chorion frondosome or the fetal placenta. So this is the fetal component of the placenta. If this is the fetal, you already know this is the maternal, and placenta is helping for nutrition, gaseous exchange, excretion, and all that, attaching the baby to the endometrium of the maternal component. Now, as we draw this diagram of the uterus and the conceptus inside, let us first focus upon the three layers of the decidua. Say, this is the uterus, and we are looking at the uterine cervix here. The functional endometrium of the uterus is being divided into three components. One remains at the periphery, as you see, and one of them is covering the conceptus as a capsule, becoming continuous with the endometrium wall, as you will name them now. One is towards the conceptus here. This is the decidua basalis. So here is the decidua basalis, which is the maternal placenta component, whereas the other two you can mention. The one which is covering the fetus is decidua capsularis, and the one which is still at the periphery, decidua parietalis. Between the two, we have this cavity. This is the uterine cavity, which gradually becomes narrowed down as the baby is growing. Now, let us show the baby as well. Say, this is the baby covered by the amnion here, suspended in the amniotic cavity, and this amnion is continuous on the umbilical cord or connecting stalk as well, and thence becomes continuous with the chorion on the outside. The cavity between amnion and chorion is the chorionic cavity. So as you can see, let us magnify this diagram a bit. You can mention this is the baby which is suspended in the amniotic cavity covered by the amnion, and this amnion is covering the connecting stalk or umbilical cord so that it becomes continuous with the chorion. This chorion is on the outside, and between chorion and amnion is the chorionic cavity. Now, it is this chorion towards the decidua basilis which is having finger-like projections, the chorionic villi. You can show them here. The chorionic villi, and this is what we are calling as the chorion frondosum. That is the fetal placenta. And now this is the region of the umbilical cord or the connecting stalk. Now what we need to know is details of primary, secondary and tertiary villus. The finger-like projections coming from the chorionic component of the fetus. We call it as primary villus when we have got only the cytotrophoblast and the syncytiotrophoblast. This is actually a cut section which is showing the inner cytotrophoblast and the outer syncytiotrophoblast. This is on day number 12 of the conception, post-ovulation basically. Then we know that there will be some extra embryonic mesoderm formed, and we know that it is a controversy who is forming extra embryonic mesoderm. The final answer is the primary yolk sac cavity, the cell lining that will be forming the extra embryonic mesoderm. But as the extra embryonic mesoderm has come, which is after day number 13 to 15, this is called secondary villus. And in a cut section, you can see the extra embryonic mesoderm is towards the interior. And when it comes to the third week, that is day number 17 to 21, third week going into fourth week, when the uterine placental circulation is also getting established, we have got the fetal blood vessels now. And the fetal placental circulation is established. Let us magnify this cut section of the villi and repeat the information once again. Here we got the primary villus when we have got only the cytotrophoblast and the syncytiotrophoblast. As we say, the trophoblasts keep on dividing and lose their cell membrane, become a syncytium. And when it is secondary villus, you have got the extra embryonic mesoderm towards the interior. So here, this is the extra embryonic mesoderm. The secondary villus, it becomes tertiary once you get the fetal blood vessels also inside the extra embryonic mesoderm. This is the time when you have third week moving into fourth week, and the fetal placental circulation is beginning. Now, there is a difference between uterine placental circulation and fetal placental circulation, and we are going to discuss that now. Here we are drawing the diagram of the uterus. This is the cervix here, and this is the uterine artery which is supposed to supply the uterus. Now the uterus has got the baby, and between the mother and the baby there is placenta. Placenta is having two components. This one is the fetal placenta, the chorion frondosum, and that one is the maternal placenta, the decidua basilis. Now in the beginning, the blood from the uterine artery is reaching the maternal placenta, the uterine placenta. So we call it as uteroplacental circulation. And when is this uteroplacental circulation established? It is day number 12 plus minus 1. Some books will say it is day number 11. Some will say 12. Some will say 13. So we are mentioning day number 12 plus minus 1. This is uteroplacental circulation. Only the maternal placenta has got the blood. There was this primary villus developing, secondary villus developing, and then comes the tertiary villus. That is day number 17 to 21 we have mentioned. When it is day number 17 to 21, means the third week of development, there is a tertiary villus. In tertiary villus, we have got the fetal capillaries, and that is the time when the blood has entered the fetal placenta. And this is what we are calling as fetal-placental circulation. So fetal-placental circulation, when is it established? You look into Williams Obstetrics, day number 17, look into some other obstetrics books, day number 21, but it is a range of 17 to 21. So there are two terms. One is uterine placental circulation, day number 12 plus minus 1, and then there is fetal placental circulation, which is day number 17 to 21. And to tell you, this fetal placental circulation is a misnomer, because you know, this baby is not a fetus. It is still an embryo. Week number 3 to week number 8, it is called embryo. So you better use the term embryo placental circulation. If you use fetal placental circulation, you are using a misnomer here. And let us go back to the question where we started this discussion. We were being asked about a wrong statement regarding the development of the placenta and the placental membranes. And as we mentioned in the beginning of the discussion, this tertiary villus, the third villus, is in the third week, day number 17 to 21, not day number 10. At day number 10, it is primary villus. So this is a false statement, and that is our answer. Do you mean to say the fetal circulation is established at day number 17 to 21? See, fetal circulation means fetal placental circulation. And yes, it is day number 17 to 21, the time when we have got the tertiary villus. There are some fetal capillaries appearing and the blood flow is beginning. No problem with choice B. And what about choice number C? You know, this decidua bacillis is the maternal placenta, of course. And when the blood was reaching the maternal placenta, it is day number 12 plus minus 1. We have mentioned this is uterine placental circulation reaching the maternal placenta by day number 12 plus minus 1. And when is it reaching the chorion fructosum? That is the fetal placenta. Fetal placental circulation, day number 17 to 21. So as such, if we wanted to have a false statement, the false statement remains choice number A. At this time, what you have got is primary villus, not the tertiary villus. Tertiary villus will appear only in the tertiary week, the week number 3.